A Lunar New Year like no other. The streets of Wuhan almost deserted. A city with a population close to that of Ontario, where no one is allowed to leave. Most residents are doing as advised, staying indoors. Or they are stretching the resources of Wuhan's hospitals. This footage appears to show bodies lying next to patients being treated. That is why Chinese authorities are keen to show off this remarkable construction project. They're building a 1,000-bed hospital in 1 week. Across the region, the response is ramping up. Across the country, public events have been cancelled and there is a huge demand for surgical masks. And across Asia, governments are rolling out screening measures, all because just how this new strain of the virus spreads remains uncertain.
We encourage the authorities in China to investigate a lot into this virus and to share whatever they find. We need to know whether we can maybe develop a vaccine against it. Whatever is important.
Thousands left the region before the lockdown. The question is, were many of those people unknowingly infectious?
The key thing that determines whether case isolation and quarantine will work is whether or not any transmission occurs before the virus becomes symptomatic. So if that happens, then of course it's very difficult to contain.
The death rate for now among confirmed cases is about 3%, and many of those people had underlying health conditions.
A lot less dangerous than the recent coronavirus MERS, and probably less dangerous if you get it than the SARS virus. What we don't know is how far it's going to spread, and that really is something we need to plan for all eventualities.
The World Health Organization says all countries need to be ready to act quickly. Redmond Shannon, Global News, London.